Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes. Long-acting reversible birth control options have been increasingly popular among women seeking convenient and effective ways to manage their reproductive health. Some of those devices are intrauterine devices and implants. So today we're talking with obstetrician and gynecologist Dr. Ellie Hood about those options and whether they're the right options for you. Thanks for being here.
Thank you.
We're talking about intrauterine devices, or IUDs for most of us. Tell us what that is and how does this prevent pregnancy?
So an IUD is part of the class of contraceptives called long-acting reversible contraceptives. You might hear them referred to as LARCs. Implants or Nexplanon is also included in this category. The IUDs stand for intrauterine device, so they're going to go up through your cervix and into your uterus. There are IUDs that are non-hormonal and then IUDs with hormones. And they work to prevent pregnancy, and the ones with hormones actually work to help your period as well. The rod in the arm, the implant or the Nexplanon, that one also prevents pregnancy, and it releases hormones all over your body to stop ovulation and therefore prevent pregnancy.
Okay, so let's talk about how long can these options work. For an IUD, how long can you have one IUD and how effective is it?
Right, so there's several different options for IUDs, and they range anywhere from 3 to 10 years that they're effective. The non-hormonal one, the copper one, is effective for 10 years. The Mirena, which has hormones on the IUD, it's effective for 8 years, and that it used to be 5 years, and they changed it to 7, and now we're at 8 years. So that's a great thing for that IUD. And there's some other options, and those are effective anywhere from 3 to 5 years for the IUDs as well.
Who would IUDs be the right choice for?
So an IUD is a great choice really for anybody who wants it, right? So it's always a great idea to come into your doctor and have a discussion about which birth control is right for you, and simply ask, I'm interested in an IUD, would it be a right fit for me? Some reasons why we wouldn't want to prescribe an IUD for somebody, obviously, if somebody's currently pregnant, if they have a history or currently have breast cancer, if they have any uterine anomalies, like a bicornuate uterus, then an IUD would not work in that situation. If they have a current pelvic infection, then we would not want to introduce an IUD at that time either.
Can an IUD be used by someone who has had children and not had children?
Absolutely. It can be used in somebody who's never been pregnant before, and certainly, in somebody who's had a pregnancy.
Okay, let's talk a little bit about the implants. Those are the what you put into your arm. How do those work? How long do those work? And who would those be right for?
Right. So the implant in the arm is called a Nexplanon, and it has a progesterone hormone implanted in the rod. It's effective for 3 years. It prevents ovulation and is very effective, 99.9% effective against preventing pregnancy.
What are the pros and the cons? I know there are different forms of birth control. There are pills that you can take every day. Why would somebody want to go the long term?
Well, these are set it and forget it methods, right? So you don't have to do something every day, and that's what makes them so effective. Some people have trouble remembering to take a pill every day. Some people aren't interested in getting an injection every 3 months for their contraceptive method. So these are definitely great options for somebody who doesn't want to fool with taking birth control on a regular basis.
Yeah, set it and forget it. Like you said, That's it. How does the appointment go when you choose an IUD or an implant?
Right, so hopefully we've had a discussion beforehand about getting an IUD or an implant so that we can go over all the methods of birth control and make sure that one of these is right for you. We can also, check with your insurance company, make sure that it's covered. And we can explain to you what to expect during insertion so that maybe that's not as uncomfortable for you.
What happens if you change your mind? Is it easy to have the devices removed?
Absolutely. We can remove the devices before the time is up on them. If you, just decide you don't like it, if you decide that you want to get pregnant, we can absolutely remove either the implant in the arm or an IUD before their time is up.
Is that a complicated process?
Generally, it's not a complicated process. Again, it's done in the office, and it's usually quite straightforward and simple.
Okay. Dr. Hood, thank you so much. Great information for women to consider. Long-acting removable birth control. We appreciate your time. Thanks for checking in for Monday Health Minutes.